Ground rules for today's event. I'd like to tell you about the format and some ground rules. There are going to be two rounds of presentations by the panelists of 8 to 10 minutes each. The first round is what we're calling diagnosis of the problems in the current healthcare system that may need to be addressed by any potential legislation. And the second round, our panelists will explain their prescriptions, the kind of legislative responses which they believe would be most effective to deal with the issues they've raised. I'm also pretty sure that in the second round of questions, our panelists will talk about how well the proposals currently before Congress deal with the issues they presented as being issues that need to be dealt with. That should put us at about 90 minutes. The last half an hour will be a question period, but the questions are to be written on note cards. At the end of the first round, our staff will go around and collect the questions. They'll be collated by subject matter, and they will be asked by the moderator. No questions will be asked from the floor. I have to emphasize that this panel is designed to give us an opportunity to have a respectful hearing of a variety of viewpoints about a very contentious public policy issue. No matter where you stand on the political spectrum, you will be sure to hear things that you disagree with at this panel today. However, only one of us is paid to get yelled at by the public. Actually, I am paid to get yelled at, only by Jews. And we really respectfully request that you refrain from disruptions of any kind. Anyone who tries to shout or drown out the conversation will be asked to leave, and if they refuse to do so, it'll be dealt with by the security. I am determined that this is going to be the most respectful conversation about healthcare reform for people who disagree about it in this country. If you want to shout, you can do it outside. Now that we have that out of the way, the reason the Jewish community of Wichita is sponsoring this event is because healthcare reform is considered a major legislative priority by virtually all of the national Jewish organizations. The United Jewish Communities, Jewish Federations of North America, the Jewish Council on Public Affairs, Hadassah, the National Council of Jewish Women, the B'nai B'rith, the Conservative and Reform denominations, and the rabbinical associations have all endorsed and are actively advocating for meaningful healthcare reform in the current legislative session. Right? Although this should not at this point be considered an endorsement of any particular legislation, mostly because there isn't any particular legislation that's all the way through yet, a flyer addressing what we hope to see from this effort can be found on the table, was found on the table outside, and we have more of them available if you'd like to see them. The underlying principle, and much of what those flyers say, will be brought up in the discussion today by our panelists. The underlying principle, I believe, is that healthcare should be based on need rather than ability to pay. The Jewish community has taken this stand because Jewish tradition and the values we derive from it very clearly tell us that this is a moral issue. Now, I know that there are people who believe that it is immoral to take money from one person to help another person, but I have to say that this attitude does not jive with my understanding of Jewish teachings, or indeed with Christian teachings as far as I'm familiar with them. In fact, the Hebrew scriptures and the Christian scriptures that claim them in their source hold precisely the opposite to be true, that it is the responsibility of the community to support those in need. In Leviticus it is written, "You shall not stand idly by the blood of your neighbor." And the obligation to save a life is so fundamental as to supersede nearly every other law. It is for this reason that the great medieval sage Maimonides listed healthcare first on his list of 10 most important communal services that a city is supposed to provide for its residents. The rabbinic principles enunciated in the Talmud insist that while physicians are not to be expected to perform their art for free, no person is to be denied medical care based on their ability to pay. It is the doctor's responsibility to lower their price for a person in need, and where that is not sufficient, it is a societal responsibility to subsidize health care for people in need. It really is in Jewish law. It really actually does say that. I have a citation for you if you're interested. And this is not solely an individual responsibility, but is a communal one as well. There's another text that I want to bring that addresses this question of whether it is right to ask one person to pay for the well-being of another. In Deuteronomy, we are warned that when things are going well for us, when we have food to eat and houses over our heads, vineyards and silver and gold, we should take care lest we say to ourselves, my power and the might of my own hand have won this wealth for me. Remember that it is God who gives you the power to get wealth, end quote. I guarantee you that every person in this room, whether we're aware of it or not, knows someone who is unable to afford health insurance, or has found to their shock and dismay that the health insurance they thought they had didn't cover them when they got sick, or has had to decide whether to get the medicine or to eat dinner, or is facing a bankruptcy due to medical costs. To me, it is clear that the appropriate moral response to this question is not, I got mine, but rather, there but for the grace of God, go I. It is in the interest of finding common ground on this issue that we begin our discussion with what we are calling the diagnosis, an analysis by each of our panelists of what needs to be addressed in our healthcare system as it is currently constituted. The bios of the presenters are on the flyers that were on the table. If you're sitting next to somebody that you're married to and can spare a couple of them, we have some other people who need them. And at the end of the first round of questions, as I said, we'll go around and collect the questions. So, but we're going to begin with our diagnosis. The bios are on the flyers, so we're not going to introduce everybody here. You can find out who they are on the bios. We're going to begin with Dr. Douglas Bradham of the University of Kansas School of Medicine. Dr. Bradham, your diagnosis, please.